It counts it counts the first couple of groups. It does a really lousy job of counting the third one. And then the Department of Education has a much broader definition, McKinney-Vento definition, and that includes everything that HUD includes, plus these are really very different. So these are really very different definitions of homelessness. So how many children experience homelessness? And here, timeframes matter as much as definitions. Okay, so HUD has a one-night count of sheltered and unsheltered people, and the last one that it's published was the January 2024 count. And then it does unduplicated shelter counts over the course of a year. And the last one they've published there was from the 2022 year. It's not, basically, we haven't had any new publications in the Trump administration. And so I don't know if they're going to be continuing to come out or not. They're mandated by Congress. The Department of Education counts only public school children, and so that's mostly kindergarten to age 12, but it includes younger kids if there's a preschool public school in a jurisdiction. And actually, the data I'll show you is from 23, 24, not 2021. And then there's the Voices of Youth Count survey, which looked at households and asked households whether they had a member who had experienced homelessness, and they used a broad definition there. Um, so if we look at the HUD data, and that's the point in time count, so that's one night, we find that there are about 150,000 kids under the age of 18 who are experiencing homelessness. Almost all of them are with their families. There are under 3,000 kids under 18 who are unaccompanied. HUD defines young people 18 to 24 as youth, and the Voices of Youth count counted them up to 25. Many definitions of youth homelessness count young people up to age 24 or 25. For HUD, that group of youth was about 58,000 in 23, 24. And over half of them, 35,000, were unaccompanied. But the annual counts are much bigger. So we don't have an annual count of people who are on the streets. We do have an annual count of people in shelter. And that's pretty good data. The counts of people on the street are always lousy. The counts of people in shelter are pretty good because jurisdictions are mandated to keep track of that in homelessness management information systems. And you can follow individuals even if they move from one shelter to another and get an unduplicated count of people over the course of a year. And the unduplicated shelter count is about 4 times as large as the pit count. So 4 times as many people are in shelter over the course of a year as are in shelter on a single night. And we have reason to think that the folks on the street are probably similarly, 3 or 4 times as many are homeless over the course of a year or as are homeless on a single night. Okay. So the time frame matters. If you extend to a lifetime, estimates go as high as 7% of the population by the HUD definition experience homelessness, and twice that number by the Department of Education definition. That's if you call people up who are in conventional housing and ask them whether they've ever been homeless. Those are the kinds of percentages that you get. So much, much larger over a longer period of time. if you look at just the school age kids in the NCHE data, using that broad definition, including doubling up, they try to get an annual number. They miss people, all shelter counts miss people, um, and it's about 1.5 million. And about 10% of those are sheltered or unsheltered. About 10% of them would satisfy the HUD definition. Um, and a smaller number, less than 10%, maybe 8%, are unaccompanied school age youth. Okay, so how who you're talking about and over what time frame you're talking makes a big difference in how big the numbers look. The Voices of Youth count suggests maybe even higher levels. They did a household survey and they asked households with a member 18 to 25 whether any member of their household in that age range had been homeless by the Department of Education definition. And 12.5% of households said yes. And a follow-up interview with the youth themselves gave a rate that was a little lower of about 9.7%. And so that would be an individual rate. For kids, for young people 13 to 17, 4.3% of households with a member of that age said that that child had been homeless by an even broader definition. So it includes the Department of Education, it includes kids who ran away, kids who were last to leave. You know, they may have been staying with a friend overnight after they were asked to leave. They may not have been on their own. That may have even included homelessness with their families. Um, and the final numbers here come from the American Community Survey. So that's a census instrument. And that's essentially a rolling point in time count. So the census, once upon a time, had something called the long form, probably before most of you were paying attention to the census. And that's been replaced by the American Community Survey, which on a rolling basis surveys people in households. And using data from that survey, Richard tried to develop doubling up estimates for the year 2019. And so at the point that you're interviewed, you're asked about doubling up tonight. It's conducted over the course of a year, so I say it's a rolling point in time count. And those are the percentages of the population who are doubled up. The highest level is 18 to 24-year-olds, you know, young people who are having trouble breaking out on their own. And often those are parents of young children. Somebody 18 to 24 who is not married and doesn't have children would not, by Richard's calculation, be counted as doubled up. And again, we see more substantial numbers of children, 0 to 4 and 5 to 15, than of adults 25 and older. So this is the HUD PIT data, the point in time, and it shows the proportion of people experiencing homelessness who are different ages. And the biggest group is people under the age of 18. Okay? Now, people are under the age of 18 for longer than they're 18 to 24 or 25 to 34, but still it's a fifth of all the people who experience homelessness are young people under the age of 18. So this, instead of looking at the proportion of people experiencing homelessness, looks at the proportion of the population. And the last time HUD published the data from which this could be calculated was 2017. It was pretty stable up until that time, and there's no real reason to think that it's changed much. The age at which you are most likely to be found in a homeless shelter is infancy. Okay, so that's really shocking. Let me say it again. The age at which you're most likely to be found in a homeless shelter in the United States is infancy. Rates go down a little bit from 1 to 5. And they drop substantially when kids get to public school age, when the, education statistics would kick in, but also childcare expenses drop. So when you think about it, this isn't so surprising, right? It's not just that infants outgrow their clothes every time you turn around. It's also that an infant requires a parent or some other adult to take care of them. And so it takes somebody out of the labor force, or it uh, leads to, kind of costly childcare. And either way, that puts a strain on family finances at a time when most of the parents are also fairly young and aren't in their peak earning years. So it's, when you think about it, it's not crazy, but it does say something about our society. So when we think about the face of homelessness in the United States, we should think not just about folks on the left, who may be the typical sort of client of a street homeless program, but kids on the right. And even the distinction between single individuals and families is somewhat problematic. So, for example, in the California statewide study of homelessness, which got a representative sample statewide, 43%, two-fifths of parents with minor children were separated for reasons associated with homelessness. So one respondent in that survey said, I raised my son from birth to 5.5, almost 6, when I decided to let his mom have the baby because I was going to end up homeless. And I knew it was coming. So okay, well, I don't want my son to be out on the streets. So she had a roof over her head. It's smarter for her to have the baby. Right? And even when parents aren't separated from children, they are terrified of being separated from children. And so they do things like, when they're sleeping in cars, they try to make very sure that nobody knows they're there. And in California, there are a lot of kids and their parents sleeping in cars. That's geographically dependent. In New York, where families have a right to shelter, you find very few people who are unsheltered, relatively speaking. California has about the highest rate, and New York has about the lowest rate of people living unsheltered. And families in particular, you're just not going to find living in cars in New York the way you do in California. So, what leads to homelessness for families? Well, partly it's what's leading to homelessness for anybody, high rents. Um, and for families, we also have childcare costs. We've seen that family homelessness goes, or child homelessness goes down when kids get to school age. And they can go to public school and the childcare expenses go down. Adult behavioral health is much less important for families than it is for single individuals. Domestic violence does play a role for families, and child disability plays a role as well. Adult disability for any kind of homelessness, but child disability for family homelessness. And then social exclusion, racism, and exclusion of LGBTQ, especially young people. Mm. So let me just expand a little bit on some of these. These are data from Colburn and Aldern showing that rent is the major driver of homelessness, of city to city variation in homelessness. And so the graph on the left shows that there's really a strong relationship between rent in a city and homelessness per 1,000 people. Okay. And they're using pit count data for the homelessness. For counties, the relationship is there. It's a little less strong. And counties are, often a little bit more geographically diverse. Um, Access to benefits matters. So for families, the major access to benefits that is important is TANF. Food stamps and or SNAP and WIC are less variable across states, but TANF access is pretty variable across states, and it is associated negatively with homelessness rates as calculated by the Department of Education. So Parolin calculated that increasing TANF access nationally from the level in the lowest state to the level in the highest state would lead to a 34% decline in student homelessness by that Department of Education definition. And then I said behavioral health was less important for families than it was for single individuals. And it's also much more transient for families. So these are data from the Family Option Study, which enrolled nearly 23,000, I'm sorry, taking off by a lot, 2,300 families experiencing homelessness. And in followed them up for 3 years and found that with mothers on the left and fathers on the right, uh, we have huge decreases in psychological distress. That's the blue, alcohol dependence, that's the green triangles, drug abuse, the purple circles, PTSD symptoms, that's the red, came down a little bit less. And the drug abuse levels, this was a measure that looked at any indication of impairment from drug abuse. And we have, under only about 13% at the outset when families were recruited in homeless shelters. And that's dropped among moms to about 3%. 3 years later, it's dropped among dads from something like 18% to something like 7%. And so that's a very generous measure of substance abuse. And it just isn't as big a problem among families as it is among among single individuals. Right? The final one I want to highlight is disability from those same family options families. And 1 in 5 families in that study at the outset, where families were recruited in homeless shelters in 12 sites across the country, said that their child they had a child with a disability. And the most common disability reported was mental health. But there are also a variety of physical issues, respiratory systems, nervous systems, blood circulatory systems, endocrine, nutritional, metabolic systems, and so forth. Uh, so these are parent reports. They're not, medical diagnoses, but they suggest a pretty high level of disability, and that can be another cause of homelessness among families. If you're caring for a disabled child, it's even more difficult to hold down a job and to gain income. Okay, so that's a lot about the causes of homelessness. So what does that mean for you as medical professionals? Um, what's your role in all of this? Well, one thing you want to do is to help families to access the benefits to which they're entitled. And you may feel like that's more social work than medical, but if we take seriously the idea of social determinants of health, the best thing we can do for the health of families experiencing homelessness is to get them to not be homeless, to get them housed. And so we already mentioned that TANF which gives families income, is a or levels of access to TANF is a big predictor of homelessness by the Department of Education definition. If we can get families who are entitled to TANF by reason of income onto TANF, that can make a big difference in whether they're able to sustain housing. The WIC program is important for the youngest kids. That's Women and Infants and Children Nutrition Program. SNAP or food stamps. Housing assistance is a really important intervention. And I list all of these others in part because housing assistance is so rare. Only about 1 in 4 households in the United States who are eligible by reason of income are able to get housing assistance. And the typical form of housing assistance at this point is a Section 8 voucher or a housing choice voucher. The feds prefer the term housing choice voucher. Um, on the street, people talk about Section 8, and that holds families' housing costs to 30% of their incomes. And in that family option study, where families across the country were recruited in homeless shelters, that was an experiment where people were assigned to priority access to different interventions. And families who were assigned randomly to priority access to housing vouchers fared much better than other families. They were much more likely to be housed. They were much less likely to have frequent moves. They were less likely to be doubled up. They had higher levels of food security. They had lower levels of psychological distress and substance abuse and domestic violence. So I showed you that for everybody in the study, those kinds of behavioral health problems dipped, but they went down further and faster for folks who got access to housing subsidies. There were fewer separations of children from parents, and there were fewer behavioral problems for kids as reported by parents. Kids' school attendance improved. So enormous benefits to families simply by giving them access to housing that was affordable without any specialized services. So families were free to access whatever services they wanted in the community. So the service that most families most need is childcare, because those kids are young for the most part. And if they can get subsidized childcare, that can be very, very helpful. And often there's kind of a catch-22 situation where you can't get a job unless you have somebody to take care of your kids, and you can't get childcare until you have a job. And families get caught up in that. And then there's disability services. So that can include both disability income for families, and it includes services that help families to cope with whatever disabilities their children may have. So, as a the things that you can do is disability screening. Can you document the disabilities that families have that might entitle them to disability income and might entitle them to disability services and be helpful to the well-being of both the parents and the children? Um, and the last thing I would say for your role is to be very thoughtful about child protective services. So this separation of kids from parents and families experiencing homelessness is rampant. And it's something that families are terrified of. And so if they think that they're at risk for that, they will avoid social services where they might lose access to their children. And it's clear that race is involved here. So, in a study in one of the sites of the family option study, Alameda County, we matched data about families' use of shelter to data from the Child Welfare Service. And we found that when families became homeless, reports of child welfare, reports to child welfare, reports of abuse and neglect spiked for Black families, but those reports were unsubstantiated. So, when the child welfare people looked at it, they said, no, this is not abuse or neglect. Um, but they didn't spike in the same way for white families. And we think that some of the professionals that families were involved with in shelter or in other services were the reporters here. And sometimes those reports were based on cultural differences in how people think about parenting, different differences in parenting styles. So nobody wants a kid to be abused or neglected. But I think as professionals, even if you're mandated reporters, you want to think very carefully about whether what you're seeing is a cultural difference, whether what you're seeing is a product of hardship, and if that hardship can be alleviated, the problem will also be alleviated, or whether this is a problem that really merits reporting to Child Protective Services. Because those reports follow families, and even if a report is unsubstantiated, it stays on a family's record, and the next time there's a report, the child welfare people say, well, this is the second report, and they take it more seriously. Um, many of you will be mandated reporters. I'm not suggesting that you not follow your duty to report, but that you be thoughtful about it and think about whether you're, part of the oath that you take is to do no harm, and to think about whether a report is actually going to be harmful to a family rather than protective of a child. Okay, so I'd like to open it up to questions. I also, if you want more about any of these issues, I've talked about them at length in a book. It's not just about homeless kids, but it certainly looks at children and families, among other things. Okay, so let's go to comments and questions. I see there's some stuff in the chat.
I just wanted to say thank you for addressing family policing. I think that's so important, especially during, our current political climate where we're seeing increased criminalization of our community members, and a lot of people are so risk adverse within the clinical settings. And I just was really happy to hear you talk about that. And I encourage folks to be risk courageous during this time. And I was the one that dropped a couple links in the chat, Dorothy Roberts' book about family policing, as well as another book and an article by her.
Mhm. Yeah, and we have qualitative data from parents in shelter that say that staff threatened them with reports to Child Protective Services to get them to comply with whatever rules the shelter may have had. Uh, and which is not to say that the staff in the homeless shelters are evil people. They're trying to do the best, and they just think they know the best. Um, and Sometimes they do, and sometimes they have some cultural blinders.
Thank you for the presentation. I do have a brief question.
Hmm.
Uh, my group regularly works with kind of that awkward age between 18 to really 25, 26 age range.
Hmm.
And kind of with that, aside from a major need for them being access to healthcare, medical insurance, or health insurance, etc., a big need for them excuse me, a big thing for them is that a lot of them are single, a lot of them don't have that family support. My question is, what, in providing care for healthcare for them, what additional resources or services should my group be considering when interacting with this demographic?
Hmm. Okay. And so those folks would certainly be considered youth by many definitions of homelessness. And I have focused more on younger people who are still with their families, though that your age group often is parents of young kids. And I don't know whether the folks that you're dealing with are sometimes parents or whether they're always so-called unaccompanied.
Half and half. Yeah.
Uh, and so to the getting them whatever benefits they're entitled to is really important. And young people who are unaccompanied, who don't have kids, have very few benefits to which they're entitled. They can get food stamps, but not at a very generous level. Um, and they're likely to be pretty low on the waiting lists for subsidized housing. So, uh, but the first step would be to try to get them whatever they can. And what state are you in?
Georgia, Atlanta, Georgia.
So that's not a Medicaid expansion state, is
No,
it?
it's not. Yeah.
Yeah. So um, with Medicaid expansion, you can sometimes um, argue that housing is a medical necessity. That's going to be harder in Georgia. Um, what do other people on this call have to say? I mean, you probably can learn more from each other. No volunteers. Um, it's it's a hard period in young people's lives. Some of your young people will have probably aged out of foster care. That's a group that's at very high risk of homelessness, not just in the months after they age out, but for the next 10 years or so, because they don't tend to have the family supports that likely to enjoy. Unemployment is high among young people. So people are having trouble starting out, even if they're college graduates from middle class families. And poor kids just have that many more strikes against them. Um,
Definitely makes sense. Thank you for the insight.
I'm sorry I don't have more to offer you.
No, it's such an awkward phase for and it's not just you, it's the folks at the shelter as well. It's such an awkward phase. So I really appreciate that.
Uh,
There is one question in the chat that asks, are you able to share any data related to foster care and the related link to homeless youth?
uh, sorry, I'm we're able to share data related to foster care and related link to homeless youth. So Chapin Hall has done some of the best research linking foster care to homelessness. Every study that looks finds that young people aging out of foster care are at higher risk. Um, and the early interventions to simply extend foster care to 21 seem to postpone homelessness, but not truly eliminate it not really prevent it for young people aging out of foster care. I think there are now more efforts to try to provide some resources to young people in foster care and young people aging out of foster care. Uh, but they do remain at very high risk. It's really important that those programs offer second, third, and fourth chances, right? The day somebody's able to escape from foster care is often, one where they're very happy to get rid of the shackles, but they ought to be able to come back. And they ought to be able to come back after that. I mean, one thing that middle class families do for their kids is they pick them up after they make mistakes. And young people make mistakes. And they need additional opportunities. Um, but other than saying that it's a really high risk period, uh, and that there are interventions that different states are trying. I'm not sure what the data are about what's working. So, I mean, if you if there aren't more questions, one thing I could do, if you like, is to tell you more about the family option study and the kinds of results that we were able to get there. Um, and I'm happy to go that way, or I'm also happy to talk about anything else that you would like to talk about.
Yeah, I think that would be great.
Okay, let me get rid of this and find um that's no, that's not really what I want. Here we go. Uh so so does that give you the family option study? Are you seeing
Yes, I can see that.
the family option study? Okay, so this was a large scale intervention experiment to try to understand the effects of different housing and service interventions for families. So we randomly assigned nearly 2,300 families with over 5,000 children to three different interventions plus usual care. Uh, and the 3-year impact report was in 2016, and that I'm allowed to talk about. And we've done a 12-year follow-up that I'm not allowed to talk about yet. Um, but we've talked, the folks, the families that were recruited were typical of families experiencing homelessness. Family heads had a median age of about 29. We had mostly female respondents. We had nearly a quarter two-parent families. We had additional families, about 10% with a spouse or partner, typically the man, living somewhere else. So family shelters have gotten better about accommodating two-parent families, but they're still not very good. Uh, Most of the families had one or two kids. At least half had a child under the age of 3. And about a quarter had a child that was already separated from the family at the outset when we recruited them in homeless shelters, often because the parent chose to try to protect the child from shelter. They had a fair history of housing instability, prior episodes of homelessness, about 63%. Domestic violence is an interesting issue. I said earlier that domestic violence does figure in homelessness, but if you ask people detailed questions about domestic violence, you find that it's almost universal among poor families. And there's no difference between poor families who experience homelessness and those who don't. If you ask a quick and dirty question about whether you've been abused or threatened with violence by a romantic partner, do pull apart families experiencing homelessness from other families, with families experiencing homelessness having more of that. Um, and a lot of our families had homeless histories of homelessness as a child, or various kinds of childhood instability. Nicholas, you mentioned, foster care, and no, it wasn't Nicholas, it was somebody else who talked about foster care. And a lot of our families had that in their backgrounds. Median annual income, this was back in nearly 2 decades ago, but $7,400 even in that point was not enough to help people secure housing. So our interventions were priority access to a supportive housing voucher, not a supportive housing voucher, just a housing voucher, no supportive services. And that's renewable as long as you remain eligible, but people weren't always able to renew it. And then we had community-based rapid rehousing, which was a temporary housing subsidy. We had project-based transitional housing, that's the heavy-duty psychosocial services kind of intervention, where the idea is to bolster families to the point that they'll be, at the end of 2 years, able to manage on their own. And then usual care, which was whatever it was in our communities, which usually meant more emergency shelter and whatever housing and services families could access. And by 3 years, a lot of them had found their way into housing subsidy programs. Those were the 12 communities. They were spread across the country. Our design, our ideal design was just to randomly assign people 4 ways. But it turned out that we couldn't do that, both because a particular intervention might not be available at the particular time that a family enrolled in the study, and because the interventions often had requirements. And transitional housing in particular often had requirements that excluded many families. My favorite was a transitional housing project that required $2,000 a month in income in order to come in to the program. So what we did is we surveyed families about the criteria for the housing programs that had availability at the time that they enrolled in the study. We randomly assigned them among the programs that where we thought they would be eligible. And then when we did the comparisons, we did comparisons of each group, housing subsidies, rapid rehousing, program-based transitional housing, to those usual care families that looked like they were eligible for that intervention, but got assigned to usual care. So instead of, one big experiment, we have 3 little experiments, each with well-matched groups, and an overlapping set of usual care families. And we also did the other comparisons. And I'm going to skip over this because we don't have a lot of time. That sort of take up of the programs. And so we had, as I said, enormous impacts on homelessness and on doubling up in the housing subsidy versus usual care group. And we had no impacts essentially of rapid rehousing or of transitional housing. We had a little bit of an impact in transitional housing versus shelter stays during the period when some families were still in transitional housing, so they couldn't also be in shelter. But after they got out of transitional housing, we did not see that effect anymore. We saw effects on family separation at 20 months. We saw that had faded at 37 months. We saw an increase in spouse and partner separation in the subsidy group. We weren't sure what to make of that. Maybe that was an adverse finding. On the other hand, we found that spouse partner separation was associated with domestic violence. So it may be that the subsidies allowed some women to escape from abusive situations. And we did not find, we found similar partner separations in the other interventions. Adult well-being, we found the alcohol or drug and domestic violence effects much stronger at 27 months than at 36 months. We did not find effects on health with the sort of quick and dirty, rate your health on a 5-point scale, excellent, good, fair, poor. Um, and very little effect of the other interventions. Schools attended since random assignment. We found effects for, here we go. So we found effects on the number of schools attended. We have effects on absenteeism at 20 months, not at 37 months. We have effects on behavior problems at both time points for the housing subsidy group. We found some effects of rapid rehousing and transitional housing on absenteeism and rapid rehousing on behavior problems as well. Um, Self-sufficiency. The families that got access to subsidies were more food secure. Their annual incomes were slightly lower. Uh, and we did not see similar effects with rapid rehousing or transitional housing. That's sort of a summary of all of the effects at 20 months and 37 months. So the three comparisons, subsidies versus usual care, rapid rehousing versus usual care, and transitional housing versus usual care are at the top. The domains of interventions are down the side, and we have 20 months and 37-month outcomes. A plus is a positive effect, a minus is a negative effect, and the dot is the ambiguous effect of family separations. And you see that the effects of housing subsidies on versus usual care are overwhelmingly positive. Rapid rehousing, only scattered effects, and none of them duplicated across 20 months and 37 months. And transitional housing, even more scattered effects, really only on housing during the period that families were still uh, in transitional housing. So let me stop there because we're running out of time and just see if there are any questions about this study.
I had a question actually. So for like the child behavior, was there any data as well in like the nutrition and also like I don't know if like the school lunches, for example, like if they played an impact on whether or not that child like had better outcomes or something like that?
Mhm. We know that the kids in the housing subsidy group had better food security, or their families had better food security. Um, and we don't know, we were in 12 sites, and in those sites, we had dozens potentially of schools. Um, and so we didn't collect data from schools in this study. It was just um, several of the sites were more than one city, or, so one of our sites was Alameda, California, and there were, at least 50 schools in Alameda, from Hayward to Berkeley to Oakland to, Alameda city, so we don't have any school data. The food security is all from parent reports.
Okay, thank you. If there are no other questions, I think we can wrap up. I put all of the links that I talked about in the beginning, in the chat, so they should be there, and then I will send a follow-up email, if anyone missed them. And yeah, I think if there's no other questions, you could also reach out to Beth. But yeah.
Yeah.
Um, great.
Beth.Shin@vanderbilt.edu.
Yes. And yeah, thank you so much for presenting today. A really, really great presentation. It was very informational. And yeah, thank you for everyone for being here as well. Have a
Okay,
good
very
evening.
good. Take care.